Greetings from San Juan, Puerto Rico. I'm really sorry I could not make it to the conference, but the issue at hand is so important that I want to thank the Single Payer National Strategy Conference for taking on the fight and the struggle to just guarantee something that is so important, access to healthcare. Just imagine that you're sick and all of a sudden you're thinking whether you should have to go to the emergency room or how you're going to pay for it. Or imagine you need a medicine for your child, insulin, for example, and you just simply cannot afford it. Or imagine that you are an HIV patient, a person living with a particular condition, but you just cannot struggle through it because you have to decide whether to pay the rent or really just ensure that you keep on living. That's no way to live. It's unconscionable that about 30 million Americans in the United States are underinsured or don't have any insurance at all. In Puerto Rico, between 900,000 and 1 million people cannot afford to go to the doctor, cannot afford to get appropriate health care, cannot afford to thrive, and not only try to survive. This is a fight that we have to really take on. Yes, it is a fight mostly against large interest, big interest, those that do not need, those that do not need their lives to be taken care of, whose lives do not depend on having the money to get accessible health care will say that it's not needed. They will ask for questions like, how are we going to pay for it? Why are we going to provide health care for all? The people that say that, simply put, are the people that don't need Medicare for all. This summer, Puerto Rico underwent a peaceful revolution. We once again proved that when people come together, there is no fight and no struggle that can be stopped. Why do we have to take on this fight? Why do I thank you for taking on this fight? Because healthcare, simply put, is a basic human right. So let no elderly person, no person with a diverse background, no immigrant, no man, woman, or child, no transgender person go without the help they need, go without the medical aid they need. Let us all respect the human and basic right of living a life free of disease, of living a life where we can afford to go to the doctor. It is our time. We can get it done. Si se puede.